I'd like to ask Robyn Burley, the Director of the Workforce Planning and Development Branch, to please give a little background to the program, to the project and the strategies for implementation. Thank you very much.
Thanks, Tim, and welcome everybody. It's I think it's a fairly rare occasion for allied health professionals to all get together in a room, especially across your diverse occupational areas that you work in. So I think it's a fairly unique opportunity. So welcome. I'll just give you, as Tim indicated, a bit of the background to the project, and then how some of the ways that we can think about implementing it. The project has been a particular focus of the ministry, and in particular, Karen Crawshaw, the Deputy Director General for Governance, Workforce and Corporate, has been very interested in this area now for a number of years, and so she's really, it was very unfortunate that she actually couldn't make it today, because this actually marks quite a significant milestone in some ways. We have been beavering away, you might say, on healthcare assistance initiatives since about 2009. So following the review by Commissioner Garling, there was clear directions in terms of we needed to think about matching our skills levels and qualifications to the tasks that people are undertaking in a far more effective way, and with the main focus being on providing effective services to patients. So a healthcare assistance initiative was born through that process, and our first focus was on assistants in nursing. Assistants in nursing have traditionally worked especially in New South Wales Health, but also more largely across the health sector. They've largely worked in aged care, with only a few being utilised in acute care settings or even subacute. So we knew that they could be better utilised, and so we did a significant amount of work with a multi-stakeholder committee that included the industrial bodies, and which resulted in an assistance in nursing model of care and generic position descriptions that could be customised for hospitals and how they wish to use the assistance in nursing. It also resulted in a ways of working project out of the Nursing and Midwifery Office, and that was about equipping nurse unit managers and other senior nurses to understand how to integrate AINs into the team. So that was sort of our first toe in the water, and understanding all the components that needed to be thought through at a statewide level and put into policy or guidelines. It was very much the exploration of what we needed to do. So it gave us a bit of a roadmap as to what we needed to do for allied health assistance, as well as that enormous amount of work that had been happening in rural New South Wales Health, where Greater Southern Area Health Service and Western Area Health Service were area health services at that stage, had commenced doing work on rural allied health assistance and how you actually use them effectively within your services. So those two pieces of work formed the basis for what we have here today, and the importance of allied health professionals actually understanding how to work with allied health assistants. We've been able to build in all the way through the project. Instead of in the AIN project, it got tacked on at the end when it became obvious that there needed to be different approaches, and NUMs and other senior nurses needed to have a better understanding. So, and also the component of the assistance in nursing was fortunately there was a big Commonwealth program around the vet sector for training, and we were able to target a lot of that training into the Certificate 3, which allowed us to upskill assistants in nursing, both our existing as well as train a whole lot of new. So the Allied Health Assistant Framework has been developed through an advisory committee, which again had quite a wide group of stakeholders involved and included the the employer associations, which was just HSU in this case, wasn't it? We started with a literature review to see what had happened around in Australia and internationally. And as you know, there has been, most states and territories in Australia are doing something in this area. So there was a little bit of guidance there that we could find. And then, of course, the local health district reports, particularly the rural allied health assistant projects. We undertook a survey report, which we needed to collect data, and this again was something that we did in the AIN project. It was very useful, especially in working out training strategies. And we did a similar sort of survey, probably a bit more detailed when it came to allied health assistance, particularly because we had to cover off all the different professional areas that allied health assistance can be deployed in. So that was a fairly comprehensive piece of work, and we're about to release the results in a report form onto the website fairly soon, Danielle? Yeah. Soon as in weeks, not months, we hope. So that will be there for people to have a look at. The survey identified allied health assistance qualifications, and that was pretty important because we needed to consider what other training was required and where they work and what discipline. And then we held consultation forums with over 300 participants around rural, metro and regional local health districts. So I imagine most of you at some stage have probably been consulted along the way. So what we've ended up with is the framework that defines the roles and responsibilities of allied health assistants as they deliver patient care. We have a framework that provides a structure for allied health professionals to effectively supervise and delegate. And we've been fortunate that also not only has Hetty done this piece of work around how to supervise allied health assistance project, they've also done a bigger piece of work around clinical supervision. Though while that piece of work is largely focused at supervising clinical placements and undergrads, it also, a lot of the principles and guidelines would flow into this area. So there is now we're starting to get quite a breadth of support work around clinical supervision. And the framework also provides information to assist in growing this workforce safely and effectively. So working through your decision-making processes about what you need to have in place to utilise allied health assistance safely in your workforce, and how you can potentially think of other ways of deploying them. The implementation framework is already on the website as a guideline, which is this wonderful book, and I hope everyone's got a hard copy, so you're all sitting there reading away. We've also got some implementation tools on the website as well, which are the generic position descriptions and some other forms that help you guide through that decision-making process when you're looking to bring them in or better deploy them where they already are. We've been again able to access funding through that DEC is the Department of Education and Communities, if you're wondering, for 80 existing allied health assistants to gain the Certificate 4 in allied health assisting with their various streams of specialty by professional area. The survey identified there were about 110 of our existing workers that didn't hold a qualification. So we really targeted these places at those 110 people. So that's been a bit of a windfall, especially since much of that funding is disappearing this financial year. We had previously, again in response to Commissioner Garling's findings, we had funded healthcare assistant coordinators across local health districts. Well, they were originally across area health services and then local health districts. And they've been fairly important in terms of, we've connected in with them through the consultation process, but also the ongoing promotion of the framework. A number of them are supporting in that. So hopefully you know who those people are and you have a resource that you can go to. And then finally, as we've already been talking about, Hetty's developed the online training module. And we're holding this forum. So Sue can guide us in much more detail about what the framework is on about. And you'll be able to workshop some of those implementation ideas and take them back. It's what you'd call, if you're talking to HealthShare, as a slim implementation plan. It hasn't got the bells and whistles with the team of 5 coming out to guide you through over a 2-month period as to what you're supposed to be doing. This is we give you the tools, we give you a chance to think about it, and then you go back and you match it to what suits you best in your local health districts. I'd also like to acknowledge that the Forum of Allied Health Directors that meets on a very regular basis throughout the year has been very supportive of this project, and I'd like to thank them for that support and their input and guidance in this project. Without that, it would have been a very difficult piece of work to have done. So thank you for that, and obviously we would appreciate your continued support.